Covering a lot of ground for us this morning. Thank you so much from Gaines County. Joining us now for more on this conversation is Dr. Omer Awan. He is a physician and the senior public health contributor at Forbes. Doctor, thank you so much for being with us. You know, this is obviously very concerning for parents with measles spreading in Gaines County and health officials warning right now that the real number of cases of infections could actually be higher than what we're hearing. How concerned should parents be about the potential for wider transmission here?
Very concerned, Sam. And the reason why is because measles is so contagious. I mean, you can get measles just by being in close contact with an infected person. You can get measles just by breathing in the same air of someone that's infected, and also by touching contaminating surfaces. So this is a very contagious disease. Parents should be very worried. And also there are devastating consequences from measles. I mean, a small percentage of patients can also get pneumonia, which is infection of the lung, and they can also get something called encephalitis, which is swelling of the brain. As you saw, some will get hospitalized, and even some will die from this. So this is very concerning, and I hope parents are all concerned about this measles outbreak.
Yeah, some really serious potential complications here, doctor. So what are the common measles symptoms that parents should be really watching out for, and what steps can families take right now, even if their child hasn't been vaccinated yet, to protect themselves from the virus? And just a warning, we're going to be showing the symptoms on a screen here in just a second, but lay it all out for us if you don't mind.
Yeah, sure. So for most individuals, symptoms are mild. Typically, you can have a high-grade fever, sore throat, cough, runny nose. In a small percentage of patients, you can get things like I talked about, pneumonia, infection of the lung, or even encephalitis, swelling of the brain. But the most important thing to remember here is that all 24 people that got this or documented in Texas were all unvaccinated. So this is entirely preventable. So what needs to be done is everyone needs to get vaccinated. If we get vaccinated, then we can prevent outbreaks, and we can certainly prevent these adverse complications from measles.
Doctor, real quickly, how do you persuade parents then that are concerned about, that have vaccine hesitancy, that you need to do this, that it's science and it's important to keeping their kids safe?
Well, it's all about the data, just being transparent about the data. We know that if you get 2 doses of the measles vaccine, that provides 97% protection against measles. That essentially means you're not going to get measles if you get vaccinated. And all of these patients that have documented measles are all unvaccinated. So the numbers don't lie, Sam. And I think it's critical that we are very transparent about how we communicate this. And hopefully this provides an impetus for parents to go ahead and get their kids vaccinated.
Just incredibly important information this morning. Dr. Omer Awan, thank you so much for that. Coming up next, we are